Secretary to the Government of the Federation, distinguished Senator, honorable ministers, and of the PTF. Yesterday, His Excellency the President authorized the extension of the easing of restrictions in Lagos, Ogun, and the FCT by another 2 weeks. The lockdown in Kano was also extended by 2 weeks to address remaining challenges to containing the increasing number of confirmed COVID-19 cases. It is of great importance that we, members of the health sector and citizens, endeavor to use this period to dedicate our efforts to strive for the best outcomes, but also be prepared and prepare for the worst. As we learn more about coronavirus every day, we must be ready to adjust our strategy based on knowledge and evidence. As at yesterday, the 18th of May, 2020, a total of 216 new COVID-19 cases had been recorded in Nigeria. The breakdown being as follows: Lagos 74, Katsina 33, Oyo 19, Kano 17, Edo 13, Zamfara 10, Ogun 8, Gombe 8, Borno 8, Bauchi 7, Kwara 7, FCT 4, Kaduna 3, Enugu 3, and Rivers 2, giving an aggregate number of 6,175 in 34 states and the Federal Capital Territory. 1,644 patients have been treated and discharged from care, but we have sadly recorded 191 deaths in 26 states of the Federal Capital Territory. Even though this latter figure seems low compared to other countries, a disturbing picture emerging from the statistics is that not only are most fatalities observed to be linked with pre-existing diseases, many of them are educated, well-to-do people who chose home-based care, where complications suddenly developed and they had to be rushed to hospital. Experience is beginning to show that breathing complications in COVID-19 patients can arise with little or no notice. This is an added reason why all persons should seek medical attention when they test positive. To continue strengthening response in states, the Federal Ministry of Health and the Nigeria Center for Disease Control are assessing isolation centers all over the country, recently in Yenagoa and Oshogbo. We also continue providing diagnostic commodities and facilities in collaboration with partners. A ministerial task team led by a director of the Federal Ministry of Health arrived Calabar yesterday, Monday the 18th, to interact with Cross River State Ministry of Health. They were well received and have had useful meetings with state government officials, medical directors of federal health institutions in the state, and also met traditional rulers. The team is made up of experts of the National Primary Healthcare Development Agency, Nigeria Center for Disease Control, the Department of Hospital Services, Department of Public Health, and Department of Family Health, each one with terms of reference to work with relevant state officials to review and evaluate present status and needs of Cross River State. They will have audience to debrief His Excellency, the Cross River State Governor, before they depart from Calabar. The ministerial task team to Kano has reported improvements in processes and indices of Kano, and also of strategies to control increasing cases of COVID-19 infection in the entire region by ramping up testing, isolation, and case management capabilities. The team also paid a fact-finding visit to Borno State yesterday and made recommendations on supporting the strategy there. Viral infectious disease experts from the Federal Teaching Hospital Irua are supporting the state's initiatives with hands-on training and confidence building of healthcare workers. The Federal Ministry of Health places special priority on the maintenance and continuation of essential services in health in both private and public hospitals throughout the country because of the serious harm that arising from neglecting routine healthcare services like reproductive, maternal, neonatal child health and nutrition, immunization, and chronic disease management due to fear of COVID-19 or due to sole focus on COVID-19. Therefore, the missions to states always include officials of National Primary Healthcare Development Agency and Department of Family Health, whose assignments are to press for restoration of normal medical services. We started the session of the World Health Assembly that is normally held in Geneva every year. But yesterday, for the first time ever by teleconference, where, as head of the Nigerian delegation, I delivered a statement on behalf of the government of Nigeria, focusing on our actions and interventions in curbing the spread of COVID-19. It gives opportunity for countries to show solidarity, to share experience, to promote international cooperation in fighting this new virus. Another important outcome of the Assembly is emphasis on the need for cooperation among citizens and also with their state authorities in this fight, a war to concern citizens no less than the state, and requiring that we support and comply with adversaries that are for our survival. No policing should be needed to do the right thing. In this regard, I urge abiding by the mandatory and correct use of masks by all of us, each for the protection of the other. Masks must be worn and washed daily and ironed where possible. Masks should cover the mouth and the nose and should not be left under the chin, especially during close quarter conversation, lest its purpose is defeated. New understanding is that droplet dispersal takes place even during normal speech, and the common use of masks can significantly limit the risk of transmission, especially where people live in closed settings. Tissues must be used when coughing and sneezing and then disposed of. The stay-at-home advisory needs to be more strictly adhered to, and citizens did not undercut the ban on interstate travel by hiding in goods trucks. Finally, I wish to commend, as usual, our frontline health workers who take responsibility for keeping us safe. Thank you for your attention.